The information on aging better in uncertain times is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. We are increasingly living in a world of alternatives. Better packaging materials so we don't pollute the environment. Better nutrition as an alternative to our current menus. Better and more streaming services for our home entertainment. Driverless cars, which are aimed at cutting down the number of accidents. And among all that, there is one particular that is drawing a lot of attention and many, many questions, and that is medical cannabis as a possible alternative to our current medications. I'm Gord Martineau, and welcome to another in our series of Aging Better, as we examine medical cannabis and finding out the best information available to you. And to do that, we have two guests today with a deep and broadly based knowledge of medical cannabis and its understanding. And with us, of course, as is the case always, is our resident medical expert, Dr. Fabio Varlesi, the Chief of Medicine at Runnymede Hospital and the Assistant Professor at the Faculty of Medicine, Internal and Geriatric Medicine at the University of Toronto. In order to discuss medical cannabis, we must first understand what it is and look at the possible benefits of medical cannabis as a possible alternative to our current medications. Fabio, you probably get these questions from your client base, and how do you respond to them? What do you tell them?
Thank you, Gord. This is such a hot topic in medicine these days, and as you mentioned, my background is in internal medicine and geriatric medicine. In particular, medical cannabis is finding incredible opportunities in the management and treatment of medical conditions in the geriatric population. We have certainly a long list of medications to treat all sorts of ailments and medical conditions in geriatrics. But medical cannabis is becoming more and more popular, and this is usually brought on by the sandwich generation, the kids of elderly patients who are bringing this to their parents and to the doctors that their parents are seeing. And so we get these questions all the time. Medical cannabis is doing its best to assume the status of a medication. And it's a very long process. The way medical cannabis is isolated and presented in products is very unconventional when we compare it to medical products in our industry. And therefore, there's a huge learning curve, and doctors today need to update themselves on in this topic. Many of them are undergoing other programs and educational sessions at their universities because they're not very well versed in this field. So it is an exciting time because the potential for medical cannabis is significant, I think, but it hasn't reached the level of a medical product yet.
Let's welcome the two guests we have with us today. First, Neil D'Souza, the Senior Manager of Operations at Shoppers Cannabis Care at Shoppers Drug Mart, and Dr. Eldon Smith, Emeritus Professor of Medicine at the University of Calgary. Neil, I'll go to you first. I would best describe what you do as heading up a team of pharmacists who are not just medical and retail functionaries who hand patients and clients a bag with their prescription medicines and wave as they walk away. These are pharmacists who are trained in extensive knowledge of medical cannabis, and they have the answers to questions that people may have as they approach. So how do you address the situation if somebody comes to you and says, look, I've heard about medical cannabis, I think it may be an alternative to the medications I'm having now. What do you tell them? What can I do?
Thanks, Gord. That's a great question, and we often get patients coming in with that exact same question to see if medical cannabis would be appropriate for them. And whenever we get that question, our usual we usually have a discussion with the patient with regards to what exact symptoms they're hoping to treat. And our recommendation is always for them to speak to their primary care physicians, or whether that be their family doctor or even referring them to a specialized cannabis clinic, where they can have a discussion about the symptoms that they're hoping to treat and evaluate if medical cannabis is the best option for them.
Dr. Smith, I mean, you head up a team of researchers, and you were looking into medical cannabis as a possible preventative care item for people with cardiology issues. Tell me about the work that you're currently involved in and what kind of successes you've had.
Inflammation has an important role in a number of cardiovascular diseases. And of course, we've been interested in cannabidiol or CBD, which has anti-inflammatory, anti-fibrotic, cardioprotective actions that we think could prove out to be very valuable medication for cardiovascular conditions.
Neil, when you're speaking to patients or clients who approach you, do you tell them, look, you try to demystify medical cannabis, that people might be a little bit afraid because of their knowledge base is not what it should be when it comes to medical cannabis? Do you tell them it's okay to look at this as an alternative?
I think so, because a lot of patients may have never used medical cannabis previously, and what they know of cannabis may be sort of what they've learned growing up, and it's something for people to sort of use recreationally. And what we want to do is sort of change that impression that medical cannabis can be used for some conditions and can be very effective for some conditions. So there is a lot of evidence, for example, related to pain management using medical cannabis, and we often see patients coming in to hopefully get relief from their symptoms related to pain, whether it be chronic pain or pain associated with osteoarthritis, for example. And we often have to have those conversations with the patients to say, you know, you are using your traditional pharmaceuticals, you may or may not be getting the most appropriate relief from your symptoms using that, and why not evaluate if medical cannabis may be an alternative that might work best for you. And again, there are some other conditions that we have patients coming in besides just pain, but often that's a question that comes up, and recommending medical cannabis as an alternative, either in conjunction with their current therapy or instead of, usually does help patients get some relief from those symptoms that they're experiencing.
And are there specific medical conditions where you feel that medical cannabis should be actively considered as an alternative to current medications? Like, I'm talking about, you know, whatever medical conditions people might have, maybe insomnia, could be any number of things.
There is a wide range of research out there, and it is varied in terms of content. But the most common symptoms or conditions we're seeing patients using medical cannabis for would be pain, and that's wide ranging. So whether it be chronic pain or pain associated with osteoarthritis, for example. In addition to that, we have a lot of patients using it for insomnia to help with that, along with anxiety, appetite loss, chemotherapy-induced nausea and vomiting. A lot of patients using that, finding it very effective to help with appetite stimulation. Patients experiencing PTSD symptoms or suffering from epilepsy, and also some patients using it for to help with depression, and also spasticity associated with multiple sclerosis. So a few different conditions that we have patients that are using medical cannabis to help treat those symptoms.
And Dr. Smith, what's the connection between COVID-19 and anti-inflammatory heart disease?
Well, I can tell you that COVID is one of the most inflamed conditions that we've encountered. As probably everybody knows, COVID starts off in the lung. It gets into the lungs through a particular receptor that exists there, and the COVID virus attaches to that receptor, gets into the cells, and starts doing its damage. The infection in the lungs creates an environment in which there are high levels of cytokines. Now, these are little proteins that are produced by inflammatory cells, and they interact with other cells, often inflammatory cells as well, but it's one of the things that keeps the infection or the inflammation going. Cytokines get into the bloodstream as well, and then they're circulated around the body. And for instance, the heart, even though these cytokines are developed in the lungs, the heart eventually develops a lot of cytokines there. And in the case of COVID, the cytokines accumulate in the heart and in the blood vessels as well. And in the blood vessels, it causes interrupts in normal vasodilation and contraction of blood vessels, which is essential for normal circulation.
Have you ever been in a situation where you've been studying a specific avenue of research and you've come to a hallelujah moment? I mean, what's that like? And if it happens, what is that like? What is that feeling like when you really hit, as it were, pay dirt?
Well, I have never experienced one of those hallelujah moments myself where I have been involved in the fundamental discovery process for that particular drug and then able to pursue that through all of the research that would lead to, hey, this works. But I have been involved in quite a few of them, more as an investigator. And that's an amazing process, and everybody involved really feels a lot of satisfaction and a lot of joy as a result of coming to those kinds of conclusions.
Dr. Smith, let me ask you a question. Like 10, 15 years ago, if somebody had come to you and said, you know what we're going to do? We're going to study cannabis as a medical alternative to current medications. I mean, at that point, there wasn't the information available or the results available from any studies. If somebody had proposed that to you 15 years ago, what would your reaction have been?
I would have smiled broadly uh, and probably wished them good luck. But it's like every other thing in medicine, at least. We start off with total ignorance. We learn a little bit, and we eventually get to the point where we begin trying some of these new medications in humans. And as that progresses, we learn more and more, and that's how we develop new therapeutics. Without that process, there'd be nothing new.
Neil, I'll ask you pretty much the same question. You must have clients or customers that come in and say, "Cannabis? Wait, what are you kidding me?" They view it as the negative image that it has had over the years, and you try to demystify it for them. Is that part of what you do?
Yeah, I think there are patients coming into the pharmacy for specifically, and that stigma associated with cannabis does still exist. It only was legalized in Canada just a few years ago, so a lot of patients still look at it as a drug, for lack of a better word, or an illicit drug, and therefore they are associating with that with something that's going to be used for recreational purposes and not really help them with their medical condition. And that's where members of my team, such as at the Shoppers Cannabis Care Center, where you have cannabis-trained pharmacists, they can sort of debunk those myths, if you will, for those patients, and really explain to them the difference between what you would see maybe in the illicit market or the recreational market and what the purpose of those products may be versus what you're seeing in the medical market and how they can help treat your conditions.
And part of your advice, I would imagine, is to tell people, there are certain interactions which may be positive or negative. I mean, they may be taking a certain medical regimen currently that doesn't really jibe, let's say, with medical cannabis. Are there interactions that you tell people to shy away from?
Definitely. So cannabis is metabolized in the liver. So there are some potential drug-drug interactions that can occur with other medications that are metabolized in the liver. For seniors specifically, the most common interaction we see is related to patients using medical cannabis along with other CNS depressants or central nervous system depressants. This includes medications such as benzodiazepines, opioids, or antidepressants, and even alcohol. So when using such medications along with medical cannabis, it can cause some increased sedation and should be monitored very closely. We also usually avoid recommending THC dominant products just for senior patients, as combining them with CNS depressants can reduce reaction time and therefore increase their risk of falls. In addition, some other medications do interact with medical cannabis, including medications such as calcium channel blockers that can help with blood pressure, or proton pump inhibitors that can help reduce acid reflux, and also blood thinners such as warfarin. The number of medications that interact with medical cannabis is limited. However, it's always best to check with your doctor or pharmacist before initiating therapy with medical cannabis.
Dr. Smith, do you get the sense in any of your studies and the research that you're doing that we could be on the verge of, let's say, a major breakthrough where treatment is concerned?
I think there's quite a few of us that are very excited about the potential of molecule like CBD. THC is pretty well studied, and we know some of the adverse effects of that. Neil has just mentioned some of them. but CBD has not been well studied.
Do you get a little frustrated that it takes, you're probably used to, accustomed to it, in your research and your studies, that it does take a long time before you get the results you're looking for? Do you tell people, look, this is going to take a couple of years or X number of months or something, and people get a little frustrated thinking, well, why does it take so long to get the results you're looking for?
I think that's a large problem, but it does take time.
Fabio, these are issues that everyday people have. When they come to you as a matter of course for the treatment of various ailments they have. When you suggest medical cannabis as a possible alternative, do they say, they look at you and say, "I'm not taking that," because they're still kind of under the impression that cannabis has a negative image and they don't want to be associated with it.
That's so true. It happens all the time. There are very specific situations, medical conditions that sometimes could be resistant to the standard medications that we give. Or, for example, when giving medications, patients tend to develop a lot of side effects. There are scenarios where the opportunity for medical cannabis is important, significant, and definitely a consideration. And therefore, it takes the type of counseling and education that patients require in order to win over this as an alternative. It's not just the stigma, but clinicians really need to educate their patients about the opportunity to be able to wean off a patient from opioids, for example, that have their own list of side effects, and they're very significant. In the elderly, we see a lot of falls from opioids. So the opportunity to taper an opioid and have medical cannabis as an alternative is important, and it's certainly a consideration today.
Neil, do you ever have clients coming to you and saying, at the dispensary, I really don't like taking opioids. Is there some other medication that might get the job done for me? And I'd like to discuss that. Are you ever approached at that point with that kind of question?
Definitely. I think patients on opioids are aware of the potential risks that are associated with taking opioids, especially long term, and especially the fact that it is a very habit-forming medication. So patients on opioids are always looking for alternative therapies to help control their pain. And when they come into the pharmacy, they are looking to maybe potentially reduce their use of opioids and look at other alternatives. Sometimes they're not finding relief with the traditional pharmaceuticals, and that's why they may be looking to medical cannabis as a potential treatment option to help control their pain symptoms.
Neil, when you're talking to members of your team, it's important that you impress upon them, I would imagine, that pharmacists are an important link in this whole process because, after all, they're the ones who can take a client aside, step aside for a moment and say, you might want to consider medical cannabis as an alternative to the current medications you're taking, especially among aging clients. And so what do you tell them that's going to set people a little bit more at ease?
So with the medical cannabis program, it is offered remotely, so there is no interaction, I guess, at the store level, if you will. So they're usually talking to my team through the call center. From that perspective, though, when these questions do come up, and they do come up from time to time, it's always important to have an open discussion with the patient and be transparent with them that medical cannabis can be useful for some conditions, but it is a very patient-specific medication, and they do have to start low. They have to go slow with the therapy, and with time and dose titration, they can get the symptom relief over some time, and it is important to be patient with that process. So a lot of times that's the discussion we have to have with patients, because they may be looking at medical cannabis as a potential therapy for them, and it is important for us to be at least transparent with them as to what that process looks like and how long it may take for them to actually achieve that positive therapeutic outcome that they're looking for. And we're there to support them. We're there to help them along the way. The pharmacists on my team are there to support patients with any sort of drug interactions, for example, they may have, or especially if they have any side effects, how to mitigate that and how to deal with that. So we're definitely there to support patients through that journey.
One quick question before we go. Would you take medical cannabis as an alternative?
I think I would, depending on the condition I was hoping to treat. For example, as I mentioned earlier, the evidence for pain management is quite high, and it's been shown to be quite effective. So if I was suffering from certain types of pain, especially nerve pain, for example, which can be quite debilitating, I definitely would look to medical cannabis to help treat those symptoms.
All right, Neil D'Souza, the chief of a team of pharmacists at Shoppers Medical Care Center. Thank you very much for joining us. Dr. Eldon Smith, the best of luck in your research studies, because I think, we discussed the hallelujah moment. I think you're going to have one, because your list of credentials is pretty impressive, and I think you're going to get there.